During Monday's press briefing, Health Secretary Matt Hancock declared that Britain is winning the battle against coronavirus.
But with a further 324 deaths recorded in the UK yesterday, do we really have the pandemic under control? Professor of Evidence-Based Medicine Carl Henegan and Professor of Bacteriology Hugh Pennington are joining us now with their thoughts. Morning to you both. Thank you very much indeed for joining us. So I suppose that first question has to be to both of you. Hugh, we'll start with you. Do you believe that it's under control?
Up to a point. The falling cases, it's slower than we would like to see, but at least it's falling, and it's a consistent fall. So I suppose that's evidence, yes, that we're getting it under control. We haven't got it under control in the sense that the case numbers are tumbling, but we are on the way to getting it seriously under control, but there's a way to go yet.
And Carl, what about you?
Yeah, look, all the signs at the moment are reassuring. The community spread is at a very low level. 999 calls are at a low level. Admissions are now coming down. We have some problems with nursing homes and particularly transmission within hospitals. So that's going to be an issue going forward to prevent that onward chain of spread. If we can get on top of that, things are looking very reassuring.
So it's always difficult to look retrospectively at these things, and we always try to be quite balanced, and we don't like to rant. However, what would you say to the policy, that original policy, bearing in mind we didn't really know what we were dealing with, although we should have done, of releasing patients back into care homes?
The issue of care homes has really been a bad outcome, in effect. What we've seen is as we went into lockdown, in effect, the number of outbreaks in care homes went up. It's now at about 40%. That's a huge number that's affected the frail and elderly. And there's no doubt the policy of releasing people from hospital into homes has been a mistake. Added to that, we were completely unprepared in nursing homes. If you look at somewhere like Hong Kong, where they've had no deaths in nursing homes, they've had a strategy in place right at the outset. They were carrying, for instance, 3-month stocks of PPE equipment. If you understand all that, this has been a long-standing problem. But I want to reiterate, this is a problem that's emerged across lots of areas of Europe. In Spain, for instance, 2/3 of their nursing homes account for all the deaths. It's a problem in France, in Sweden, in Belgium. So this is a chronic underfunding of care homes, not having a strategy in place, and then seeding the infection to make it even worse. Right. So right now, one of the main issues is 60% of care homes do not have outbreaks. We need to have an urgent strategy to make sure we don't increase it now. And that requires the government to get a handle on this process and really take it to task as an emergency to make sure we don't increase the outbreaks in those care homes that are unaffected.
Professor Pennington, were you nodding in agreement there?
Yeah, absolutely. I think one of the big problems was the lack of testing. Now, we had a problem with testing because we didn't have the capacity to do it, but we weren't testing patients who were being released from hospital into care homes, and some of them undoubtedly were carrying the virus with them. And then there's the issue of the care home workers who come and go, and we know that asymptomatic carriage of the virus, you can carry it without knowing about it and infect people. That's also an issue. And if we'd been doing more testing, that would have prevented at least a lot of the care home outbreaks by stopping the virus getting in there in the first place. A care home is really a very difficult place, the way they're configured in the UK, certainly, to stop infection spreading once it gets in. You just think of the way they're designed. They're designed for social interaction between the residents and so on.
Can I also ask, because obviously people are thinking about a second spike, and a lot of this pandemic has been compared to Spanish flu in 1918, where the second wave of infection was much, much worse. Professor Henegan, what would you say about that? Is that something that's likely to happen?
Well, look, there are a lot of new terms that people are getting to grips with, like second waves. Much of that is applied to influenza. And there are some real differences between influenza and what we're seeing with COVID. For instance, in influenza, the transmission in children seems to be much more important. And so closing schools has a big impact. That doesn't seem to be the case with coronavirus. I think over the summer, what we're seeing is the virus stability, its ability to survive because of higher temperature, high humidity, is less. That's why we're seeing in southern regions the transmission is much lower. So as we go into the summer, I think what we'll see more of is sporadic outbreaks, which with our test and trace system, we have to regionally manage. And so what we don't want to do is go back to a blunt tool, which is suppression. If we have the right structures in place, we should be able to manage this locally and contain the outbreak.
The blunt tool being lockdown.
Yeah, the blunt tool is lockdown because that was our only tool in place when we didn't have the testing in place. We didn't understand how many people had the disease. But if you look to what's happened in Sweden, they had a much more subtle approach to what I call intelligent mitigation. It's understanding which bits of the infrastructure you can shut down that really slow the virus. So, for instance, mass events seem to be important in these outbreaks. Enclosed spaces are really important. And if you understand the bits of architecture that we can change and understand that social distancing and hand washing had a significant effect already, what we're looking to do is find the 2 or 3 things that can really slow this virus down so we can get on with normal life and normal structures so we can go about our daily business.
Professor Pennington, there have been reports in Italy that the virus has mutated to become less deadly. Is there any truth in that? Have you heard that?
Well, the virus has mutated a lot, and we can use the mutations to track the virus. There are different viruses in the States from Europe and so on. And that's been used for quite a long time now to track where a virus has come from. The Icelandic did a very nice study on that quite a long time ago, but there's no real evidence that the mutants affect the behavior of the virus in the sense of making it nastier or less nasty. And they would be surprised if it did that. But clearly that's being looked at very, very carefully at the moment.
Well, Dr.
hundreds
Alberto Zangrillo, who's the head of Milan's San Raffaele Hospital, the hard-hit Lombardy region in Italy, said this week coronavirus has become much less lethal, with newly infected patients having weaker symptoms than a couple of months ago. The president of the scientific body that advises the government said he was baffled by the claim.
Well, yes. I mean, I would like to see the evidence for that. And that evidence sometimes is really quite hard to get because you can't do experiments. You know, all you can do is look at the cases. And looking at cases is very, very difficult to interpret because, you know, cases vary anyway. We know that there's a very big age difference between the effect of the virus. You know, the older you are, the more likely it is to have a very bad outcome and so on. So all that makes it very complicated. All I'm saying, it's very complicated. But we do know there are many mutations. We know this virus mutates. You know, it may well be how it evolved in the first place. But nevertheless, there's no real evidence that it's getting nicer or nastier. And I would be very surprised if either was happening. But on the other hand, that is being looked at very intensively. But it will take time to really find out whether the virus has got milder. It'd be a bit surprising if it had, but there it is.
Professor Henegan, are what we're seeing with the death toll coming down is that this virus is just simply burning out?
Well, that would be a nice position if that's what we could say, but I agree with you. There are a couple of features about infections. One of the things is they tend to rise in a very sharp way, get to a peak, and then drop off. And all infections do that. Influenza does that over a winter period. One of the key elements on the way up is we tend to have more exposures because we just don't know the virus is there. And that seems to be what's happened for lots of these workers where we've seen they've been disproportionately affected. Taxi drivers, bus drivers, lots of exposures, potentially higher viral load. On the way down, your exposure to the viral load is less. One of the key things that happened in 2023 with the SARS virus is it burnt out about June, July. This virus doesn't look like it's going to do that because it's now seeded into the southern hemisphere, virtually in every country in the world. Hopefully what will happen is these viruses want to survive. They want to live side by side with us. And as it becomes endemic, it'll become less virulent. That's what we hope will happen. And then it'll become seasonal. And that's in the virus's interest, because if it does that, lower symptoms, it will survive longer. It's very important also to note within all of this that people under the age of 45 are virtually unaffected by this virus because they have mild symptoms. The death rate, the excess death rate is just in the hundreds, much, much less than the very elderly. Key though, that then people have mild symptoms, can be even asymptomatic, might just feel they've got a little cold. Key is that they isolate, they get themselves tested, And that's one of the sneaky things, the Achilles heel of this virus, is its ability for people to think, I'm unaffected, I don't feel that unwell, I'm going to go about my daily business. We really need them people to get tested, and if they're positive, to isolate themselves. That's key going forward.
Which is where hopefully track and trace will help us, and also those local lockdowns potentially that's been discussed. Professor Pennington, let me ask you, everyone is a commentator now. And it seems that people are making headlines when virology and epidemiology isn't even their specialist subject, but they're coming up with their own ideas. How helpful is that?
Well, I would say not particularly. Being a virologist myself, one of the things that's been missing out of the whole debate has been a voice from virology, partly because there are very few of us left. Britain used to be a world leader in I don't like using those terms, world leader, but Britain used to be very strong in virology, particularly in things like influenza. We essentially set up the sort of world monitoring system in the 1940s in influenza and ran it. But virologists seem to have almost died out.
But surely that's the most important field in this. So when we have our afternoon briefings, and the viewing figures of those just sort of going further and further down now, thankfully, as the peak seems to have passed. Would you have liked to have seen more virologists speaking to us in the afternoons at those government briefings?
Absolutely, because us virologists, we handle viruses in the lab, and we look at their effects on people and all that kind of thing, which gives us a little bit of insight into basically how they're behaving now. And it gives us perhaps a little bit of credibility in making predictions about the future, although that is very, very difficult. And this is a new virus, so it's very difficult to make predictions, except going back to history and looking at flu. And I think there's been a bit too much emphasis on flu, and I think a few more virologists on some of those advisory committees would have said, now, hold on a minute, we're talking about flu here, we're not talking about COVID-19. And that would have been a useful kind of, piece a sort of moral to put in there, to say, yes, let's think about this again, and let's think about coronaviruses rather than influenza viruses in terms of what we're going to do and what's going to happen in the future.
And Carl, can I ask you then? Are you in agreement there that specific expertise has been lacking in those government briefings?
It's very interesting. If you go back about 20 years, we used to have an MRC-funded common cold unit that used to explore and investigate these viruses like coronavirus. Largely what happened with the advent of HIV and with influenza and the vaccination programs, that's dominated the strategy and the thinking. So now we need to expand it out open, go back in time and start doing some of these core investigation and epidemiology studies, bringing in virology. And actually, we know very little about coronaviruses compared to something like influenza. So yes, definitely we need a different approach. We need to stand back, and we also need to not overly rely on vaccines as the only strategy, because what we're understanding is non-pharmaceutical intervention, learning about things like social distancing, which bits make a difference. We really need to understand in depth. And at the moment, our understanding is very vague and crude. So right now, while all of this is happening, while we're coming out of lockdown, many of us are starting to study and go to work to try and understand what's happening, which bits of evidence are making a difference, particularly to something called the transmission. How does this virus spread at speed that we can slow it down?
Okay. Thank you both very much for joining us this morning. That was fascinating.